Man dies after receiving the first kidney transplant from pig. At 62, Richard "Rick" Slayman became the first person in history to receive a pig kidney. The hospital performing the transplant has announced that the first man to receive a genetically modified pig kidney transplant passed away 2 months after the procedure. Prior to having the surgery in March, 62-year-old Richard "Rick" Slayman had end-stage renal disease. His death was not linked to the transplant, Massachusetts General Hospital, MGH, stated on Sunday. Although previous transplants of other organs from genetically altered pigs have not succeeded, the procedure on Mr. Slayman was hailed as a historic turning point. Mr. Slayman had type 2 diabetes and hypertension on top of his kidney disease. His transplanted human kidney started to fail 5 years later in 2018. His doctors declared he no longer required dialysis following his pig kidney transplant on March 16 because the new organ was deemed to be operating normally. Mr. Slayman will forever be seen as a beacon of hope to countless transplant patients worldwide, and we are deeply grateful for his trust and willingness to advance the field of xenotransplantation, a statement from MGH read. A xenotransplant is the transfer of live cells, tissues, or organs from one species to another. Deeply saddened by his untimely passing, MGH extended its sympathies to his family. Relatives of Mr. Slayman said his tale served as motivation. Rick said that one of the reasons he underwent this procedure was to provide hope for the thousands of people who need a transplant to survive, they stated. Rick achieved that aim, and his optimism and hope will last a lifetime. Rick was a quick-witted, kind-hearted man who was fervently committed to his family, friends, and co-workers, they said. Although Mr. Slayman's kidney was the first to be transplanted into a human, pig organs have been used in transplant surgeries before. Pig hearts were transplanted to 2 other patients, but those surgeries were not successful because the recipients passed away a few weeks later. An inherent risk of transplants, the patient's immune system rejecting the organ, was evident in one instance.